Hello, everyone, and welcome to our webinar, Understanding the Role of a Hospice Care Team. My name is Lauren King, and I'm the Provider and Community Relations Liaison at Coastal Hospice. Welcome to our Caregiver Academy. Among our attendees today, we are happy to see so many familiar organizations with us. We have colleagues from Tidal Health, Wycomico Nursing Home, Delaware Hospice, Encompass Rehab, and many more. It's wonderful to see everyone today. Before we begin, allow me to go over a few housekeeping items. You may see myself or my colleagues, Alejandra and Joy, pop up in the chat box to help or address any technical issues. I want to thank you for your patience ahead of time should we have any. I'll also come back at the end to discuss the program evaluation. We will be using the chat feature to communicate with you throughout the webinar. You can access it by clicking on the messaging icon in your meeting controls. Our webinar today will be moderated by Monica Escalante, President and CEO of Coastal Hospice. Monica has more than 20 years of experience in end-of-life care. She is a board member of the Hospice Network of Maryland and a diversity advisory board of the National Hospice and Palliative Care Organization. Monica, I'll hand it off to you.
Thank you so much, Lauren. Just checking that the audio is going okay. Give me a thumbs up if audio is perfect. Thank you very much. It is my pleasure to introduce a top-notch team. I firmly believe that Coastal Hospice is one of the best hospices in the nation, and we have some of the best with us today. I'm going to start with let's see if I can move my screen. I'm going to start with Josh Davis. Josh is our Director of Hospice Inpatient Facilities at Coastal Hospice. Josh is a certified palliative care nurse specializing in the oversight and care at the end of life of families. As the Coastal Hospice Director of Inpatient Hospice in Facilities, he focuses his efforts on cultivating, developing, and leading his teams towards providing nothing short of the best hospice, inpatient, and residential care. By actively pursuing his Master's in Science of Nursing with leadership, with a focus on leadership, Josh strives to continuously innovate, support, and enhance the care of that Coastal Hospice provides to the community at large. Welcome, Josh. It's a joy to have you here. Next on the screen, on the slide screen, is Allison Benko. Allison is a family nurse practitioner certified with the Maryland Board of Nursing and the American Association of Nurse Practitioners. She has been a nurse practitioner with Coastal Hospice since 2019, and she practices both hospice and palliative care medicine in the outpatient, inpatient, and home settings. Allison earned her family nurse practitioner degree from Walden University in 2019 and obtained her advanced certified hospice and palliative care certification in 2022. Thank you, Allison. Good to have you here. Alvin Harmon is the Bereavement Care Services Manager and the Compass Program Manager at Coastal Hospice. He is a grief recovery specialist, a certified in end-of-life doula, and an executive board member with the National End-of-Life Care Doula Alliance. Alvin was educated by the College of Pastoral Supervision and Psychotherapy, interning as a part of the palliative care teams with the University of Maryland and Anne Arundel Medical Center in Maryland. Simultaneously, he studied at the Kennedy Institute of Ethics at Georgetown University with a focus on bioethics. Thank you, Alvin. Good to have you here. Next is Reverend Sharon Hutchinson. She's the Spiritual Care Services Manager at Coastal Hospice. Sharon has been part of the spiritual care team at Coastal Hospice since 2004. During her years at Coastal Hospice, she has served in multiple roles, providing both inpatient and home-based chaplaincy services, as well as hospital-based palliative care chaplaincy support. She began managing the spiritual care department in 2016. Sharon is a graduate of Bethany Theological Seminary and has received her certification in thanatology through the Association of Faith Education and Counseling. Good to have you, Sharon. Next is Emily Nichols. She is a social work manager at Coastal Hospice. Emily Nichols graduated from Salisbury University with both her bachelor's in 2010 and a master's degree in 2011. both from Salisbury University. She earned her clinical license in 2015. With over 10 years of social work experience, Emily has worked in a variety of community settings, including child welfare, crisis intervention, and hospice care. In 2017, she came to Coastal Hospice and received her advanced credentials as an advanced certified hospice and palliative care social worker. Great to have you, Emily. And next we have Doris Ludicky, who is the music therapist at Coastal Hospice. Doris graduated from the Shenandoah University Conservatory of Music in 1996 with a bachelor's of music therapy. She loves working with hospice patients and people with Alzheimer's and dementia. Doris is certified by the certification of the Board of Music Therapists and recently became a license in the state of Maryland. I have to say that Coastal Hospice has had music therapy for their patients for the longest than I ever seen any other hospice in the state of Maryland. And that's very much thanks to Doris, who started here about 20 years ago. Next, last but not least, is Stephanie McClellan. She's a volunteer coordinator with Coastal Hospice. She has been focused on recruiting, training, and placing volunteers with our patient population for at least 10 years. She has a Bachelor's of Science degree in marketing and a communications degree from Salisbury University. Stephanie is a native of the Eastern Shore and currently she resides in Salisbury. It is a top-notch panel and it's my pleasure to moderate this discussion today. This month, we also celebrate 40, Coastal Hospice has over 40 years, but November is Hospice Month. It's the month that we celebrate our staff, but we also want to tell the world the wonderful things and the wonderful services we provide at Coastal Hospice. We want to start with our mission. Our mission is to promote dignity and quality of life for patients and families who face life-limiting conditions. And that's a mission that everyone in our organization lives by. We want to honor them for all their time with us until we can wrap our arms around their families with bereavement care. So I'm just going to jump into what makes a patient qualify for hospice care. And that's one way to see if you're on that side of the care providing services, if the patient is going to qualify. And the qualifiers, according to Medicare, are a terminal diagnosis, and that is asked to the doctors. Would you be surprised if your patient would not be here in 6 months? Because, by the way, doctors tend to be the worst prognosticators, and they admit that themselves. And I want to say that that's out of love and connection with their patients, but they usually think patients have more time than they really have. So the terminal diagnosis is 6 months or less. And the question is, would you be surprised if a patient would not be here in 6 months? The other qualifier is that the patient has the desire for comfort care and no longer pursuing aggressive treatments. In some cases, we would take care of patients at the end of aggressive treatments just to support them in that transition. And that's something that we will explore briefly as well. So how do we get paid? We get paid by Medicare. 90% of our patients have Medicare. A few have Medicaid. Many have private insurance, that's usually younger patients. And for those who are not insured, underinsured, which many patients with private insurance could be underinsured, we have fundraising. We have a community fund to care for anybody, regardless of their insurance status. Please, I have the chat box in front of me for the audience. If you want to ask any questions, use the chat box if I'm going too fast on any of these things. So this is our team, our interdisciplinary team, and it's comprised by all of these professionals, and you will hear from them today. So we have our medical director, who's also part of this team. We have our nurses, our social workers, bereavement counselors, spiritual care, volunteers, therapies as needed. And we were going to talk briefly, and we're going to experience a little bit of music therapy by Doris at the end of this presentation. And we have other certified technicians as needed. And in the course of our discussion, we're going to go in detail onto what this is about. So clinical services, I'm going to turn to Josh to help me explain, what do our nurses do when they go into homes?
Thanks so much, Monica. So having had a background in home case manager as a hospice nurse, I have a privilege of working in both the inpatient and the home setting, and meeting a lot of our wonderful team members and seeing and experiencing firsthand what they do. Primarily, first, the nurses really work to develop and maintain a therapeutic relationship. It's really through the lens of that relationship that they provide the compassionate and effective interventions that make the difference in the experience of end-of-life experience for our patients and our families. They are experts in guiding and supporting our patients' care throughout the continuum of the end of life. They will support the families in any measures that need to be taken, and also really helping to guide them in all aspects of care, and making sure that the patients have what they need to remain the most comfortable that they can throughout their process. Working with our nurses, we have our aides and our certified medication technicians. So both of these disciplines, our CNAs and our CMTs, work under the nurse delegation and supervision. So the RNs, and especially the certified delegating nurses, do monitor and guide all interventions that are taken by our aides and our medication technicians. Our CNAs are amazing, wonderful people, and really provide some very healing personal care. I've met many of our patients and families who just rave about the aides that they develop relationships with when they come into the homes regularly, and really get to know the families and the patients. So it's really a wonderful service. Our certified medication technicians primarily work in our inpatient setting, in administering the medications safely and timely, again, under the oversight of the delegating nurses within the facilities. They too do a wonderful job, and really provide so much more than the task of simply providing medicines, but really a therapeutic environment, a therapeutic relationship that really makes a huge difference for them.
So Josh, if I am a caregiver in a home and the nurse is going to come and teach me, because the majority of the caregivers fall in this role with no training at all, and they don't know how to administer medications, how to know that their loved one is in pain, or they panic and not know what to do. So I'm imagining that a large portion of what our nurses do is educate the caregiver, and that's how caregivers become more confident and they can do a good job in the homes. And sort of it's sad when you see caregivers panicking, and usually what we see in homes is an elderly spouse caring for their spouse. So tell us what a little bit of what the nurses do medication wise when you have an untrained caregiver that you're dealing with.
Yep, absolutely. And again, having my own experience with the home case manager, I can certainly speak to that quite well. That's one of the most important roles that the nurses have within the home setting, is really educating the family and the primary caregiver in knowing when maybe some as needed medications are indicated. So teaching the families what to watch for, what to look for, when we need to intervene, but B, also what medications to use and how to use them. So depending on the status of the patient themselves, the nurse will really guide the caregivers step by step through what needs to happen, when it needs to happen, and how it needs to happen. So it really helps to develop an environment where the caregivers can feel comfortable and confident in the interventions that they're taking for their loved one. And I think that primarily, again, it goes back to the therapeutic relationship that's developed, the trusting relationship that takes place between the nurse and the family. and the patient is really what bridges the gap to make sure that the family really knows what to do. And when they don't, they call us and we guide them through it.
Right. If the caregiver panics in the middle of the night, they can give us a call and one of us will show up there. A nurse will show up there and walk them through what to do, because we're a 24/7 operation. The other thing that comes to mind, Josh, is that nurses identify other equipment that might be beneficial in the home. Like in my experience, a shower bench made a huge difference for my mom, and sort of electric bed and all of those other things that you can really bring a hospital to the home, and the nurses can identify and convince the patients that some of that equipment might be helpful.
Yep, absolutely. Yeah, through our partnerships that we have within the community, we can certainly work directly with them to get whatever medical equipment might be needed in order to support the family in, whether it's completing personal care, whether it's preventing skin breakdown through using an air mattress, whatever is really needed to optimize the care of the patient within the home setting, we can certainly do.
Yep. And that leads me to our certified nursing aides that provide the personal care. We use products that will prevent wounds, and because most of our patients are bed bound. So I just wanted to clarify that. But you very successfully lead Coastal Hospice at the Lake and the Mackie and Pam Stansel House. Josh, tell us about what do we do in both settings?
Sure, absolutely. So Coastal Hospice at the Lake is really, so it's located in Deer's Head Hospital, for those of you that don't know, in Salisbury, Maryland. I see the lake, and I think the community definitely sees the lake as the acute or severe symptom management experts. We are the hospice hospital in that location, and we really specialize in addressing acute symptom needs for any patients who have either from our home population or maybe perhaps from a local facility, such as the local hospitals. We can admit patients there and immediately work on achieving comfort for them. We have many different specialized ways in achieving comfort, different methods of medication administration that we utilize and things like that. So our providers, some of which you'll meet on the webinar here today, but our providers and our staff and everyone just does an absolute wonderful job to create the most comfortable environment and really get symptoms well controlled in that environment. In addition to that, we do offer caregiver breaks, which in the hospice field, we call a respite. But in layman's terms, it's really a break for caregivers. And what that looks like is Medicare allows a 5 overnight stay for families. Say there's an individual that's being cared for in the home setting in the community, and the family needs a break, or perhaps they have a vacation planned or something of that nature. They can come into Coastal Hospice at the Lake. The patient can stay with us for 5 overnights, and the family would then, pick the patient up or take them back home otherwise. Once they returned and were finished with their break. So that's a great service that's offered as well. And a lot of times, we recognize that being a caregiver is an extreme challenge, and you need support throughout that process. And that's one of the measures that we take in order to support. Coastal Hospice at the Lake is essentially designed as a short-term stay. It is not necessarily designed as a long-term placement plan for those who need a longer-term plan. But that leads me into my next discussion, which is our Mackie and Pam Stansel House, which is located in the Ocean Pines or Berlin, Maryland area. Here we are the premier hospice residential facility. We take patients into our home-like environment and really optimize their comfort, really encourage them to create the room that appeals to them the most, and really, bring in items from home if they'd like, and to really make it more comfortable for them. In addition to that, we have some amazing staff members who really help to get to know our patients and really work a lot of one-on-one time, talking with them, supporting them, and really meeting them where they are in their process. So unlike Coastal Hospice at the Lake, the Mackie and Pam Stansel House is designed as a long-term plan. At this point, we do accept our residential patients there. And, like I said, we really do a wonderful job at both facilities, creating comfort for those that are going through the end of life phases, supporting families, educating them all along the way.
Thank you, Josh. In Coastal Hospice at the Lake is in Wacomico, and the Mackie and Pam Stansel House is in Worcester, but we have people from all 4 counties that we serve going to either of them. So Josh, if some of the people in the audience are thinking, maybe I know someone who may qualify for your services, can you walk us through how can they make a referral?
Sure, absolutely. So as you had said earlier, Monica, one of the biggest indicators of when a hospice referral should take place is when a physician feels that they would not be surprised if the patient or individual was to pass away within the next 6 months. But some of those indicators or signs that may be the case are the following. So one being increase in hospitalizations related to disease progression, recurrent or very difficult to treat infections, weight loss, decreased appetite, frequent falling and weakness, a decrease in systolic blood pressure, pain, edema, or an increase in the number of visits in the local emergency room. Those are all seen as indicators that could possibly say, a hospice referral really should be considered at this point.
I think it's important to mention for the audience that 10% of our patients are discharged because when they come to us, they are on a downward trajectory, but as we take care of them, they stabilize and they no longer qualify for our services. This is something that happens in most hospices in the nation, that patients can come in a moment when they are very fragile and they can become more stable and then be discharged from the services. So I think it's important to tell referring sources that for 10%, and that's a little over 100 patients a year, they don't stay in our program and they graduate to a different type of care. So to make a referral, Josh, what should we do?
So in order to make a referral to Coastal Hospice, you can simply call the telephone number that's listed there or send a fax to us. We typically would like to have the demographic information available, any most recent doctor's visits or nursing visits or lab work results, history and physical, and MOLST form and medication lists as well. We accept referrals 24/7, 365 days a year, so there's no restriction on when to make a referral.
Yep. So all you need to do is that number to call. And if in doubt, we have admission nurses that will go see the patient. If you're not sure whether the patient qualifies, our visits have no cost to the families. We just go and assess if the patient is eligible. So if in doubt, I would just call to get more information. And I invite the audience to use this chat room. We have quite a few people in the audience, so please, if we're going too fast, just put your questions there and we will come back to your questions. What is the difference between hospice and palliative care? Allison, please help us explain this.
Yeah, thank you so much. I appreciate everybody being here with us today. And so as Monica so wonderfully introduced me earlier, my name's Allison Benko, and I am one of the nurse practitioners that works with us at Coastal Hospice and Palliative Care, and I've been here for almost 4 years. So, I think kind of the big question in the community, and I hear a lot, is, what's the difference? What is hospice and palliative care? Well, hospice is palliative care, but palliative care is not hospice. And what does that mean? So the main difference between the two are at what point in a patient's disease process are they going to be receiving this care, and what are their goals? So hospice is meant for patients with an end stage or a terminal illness. They're at the end of their disease process. They have had, like we said earlier, some of the qualifications that we talked about, they're declining. They have to have a certification from our medical director that certifies them as a terminal illness. And they are going to stop receiving aggressive treatment for their illness. So our cancer patients would stop their chemotherapy. If you had a patient coming on with kidney disease, they would be stopping their dialysis. And on the other side, palliative care is for patients with serious or life-limiting illnesses. So some of the same illnesses that we see in hospice: heart disease, chronic obstructive pulmonary disease, dementia, cancer. But these are patients who can have this care offered at any stage of their disease process. So it can be provided alongside their curative treatments. So our cancer patients are still doing their chemotherapy. The heart failure patients are seeing cardiology and pursuing all of their treatment. And they can still receive the palliative care. So what do we both do? So I think the most important thing is that we offer patient-centered care. So we focus on what our patient needs are. And I think, one of the things I hear a lot is, if I come into hospice, I just have to stop everything that I'm doing. And that's not true. You are going to be able to continue on a lot of your medications. We're not going to come in and stop everything that you're taking. We want to work with you and kind of decide on a plan of care. What's going to work best for you and what's going to best manage your symptoms. We both focus on managing symptoms, symptoms such as pain, nausea, vomiting, anxiety, constipation, depression, shortness of breath. These are just a few of the things that we see. We do provide emotional support. So spending time talking with our patients, educating them about their disease process, talking a lot about treatment options on the side of palliative care, seeing patients in the hospital and talking about what their options are. Do they want feeding tubes? Do they want to start dialysis? What's life going to look like when they start these things? How is it going to impact their, quality of life, their functional capability? How is it going to make them feel physically? And then on the other side, what's going to happen if they don't seek these treatments? What are their symptoms going to be? What are the things, that they're going to look at facing if they decide against some of these treatment options? And then one of the, the other important things is advanced care planning, and like I was saying, making decisions about medical care. So we do talk about, what their goals are with treatment. And what that means is, what do they want to focus on? Are they focusing on continued kind of all aggressive treatment? No matter what happens, they'll deal with the side effects from the treatment, or do they want to focus on comfort and quality of life? We'll talk about advanced directives, obviously code status, what their wishes would be in an emergency setting if they were to stop breathing or if their heart were to stop, and also kind of really, talking about what those situations look like, what's going to happen to you, because not a lot of people have, those frank discussions with their patient, and it can be a really scary and terrifying thing to think about.
I think that's one of the things that our patients appreciate the most, those frank, honest conversations about pros and cons of all these treatments. I want to stress that symptom management, that both in palliative care and hospice, the symptom management can result into someone living with pain, and suddenly when they come into hospice, they feel better because all these symptoms that have been putting them down for so long are aggressively managed. And we have medications that I don't think the regular doctors understand how we use them. Allison, you can talk about some of those situations, because I've seen people that didn't have a diagnosed depression or anxiety, and then you address that, and then the quality of life just goes up right there.
It is, you're right. It's amazing. I think that, I see it a lot in hospice, but I think that, kind of one of the biggest places I see it is with our palliative patients, my patients that I see month after month, the cancer patients in the cancer center who come in, when they're first diagnosed and they have severe, terrible pain, they're not functioning, they're not able to spend time with their family, and we're able to get that pain under control, and they're able to do things that they enjoy doing. They're able to maybe take care of themselves better or spend more time with their families. Even like terrible nausea and vomiting, it's obviously something that goes along with a lot of these disease processes. And, we use medications, like you were saying, in different ways that, not other providers will use them. We have a lot of different options as far as pain medications, the route of administration. So there's, oral, there's also some topical, patches and pain medications that we can use. And we work with, our pharmacists as well to talk about some of these treatments, but it is really amazing to see the quality of life of these patients improve. And that's what our goal is, to improve their quality of life and their functional status and be able to enjoy life.
Yep, that's a big one. And who is in the teams? Can
Sure.
you talk about the teams?
Sure. We're meeting a lot of, obviously our team today from Hospice, and we have very similar, team members. So Hospice, the medical doctor, our medical director, social work, spiritual care, nurses, aides, we have bereavement volunteers. And on the palliative care, very similar, both of these are very group centered, we work together as a team. So again, we have, medical doctor, our nurse practitioner, we have a palliative social worker. We also utilize the social workers at the cancer center, spiritual care. Again, we have a chaplain on the inpatient side at Tidal Health. We can also consult a lot of outside services, and we do utilize that a lot in palliative care to help with some of these, symptoms and improve their quality of life. So things like nutrition, physical therapy. We may also, sometimes we do a lot of pain management, but we don't do interventional pain management. So we'll refer patients to pain management for things like injections, which can help manage some of these symptoms. And then we also have, which we'll learn about a little bit later, but the Compass program that we utilize in palliative care and refer our patients for additional support in the community.
Where do we provide care?
Sure. So hospice, and again, we talked a little bit about that with Josh, but in the patient's home, that's kind of the main place hospice is meant to be provided, where the patient calls home. We have our inpatient facility, Coastal Hospice at the Lake, which is here at Deer's Head, and we do acute symptom management as well as respite care here and routine home care. And then Stansel House. Then we also contract with a number of nursing homes and assisted living facilities in our community here. And then palliative care, we do inpatient palliative consults at Tidal Health, and we will see patients with any disease process, heart disease, lung disease, anything that would be a severe life-limiting illness. We have an outpatient palliative care clinic, which is located at the Richard A. Henson Cancer Center at Tidal Health. And there we only see cancer patients. So we only see patients right now with a cancer diagnosis for our outpatient palliative care. And we're hoping to expand that very shortly to our home-based palliative care program, which is in the works, where we will be opening it to all diagnoses. So it won't just be cancer. And for any of these, one thing I did just want to touch on is how do you get referred? So for the cancer center, the outpatient, the cancer doctor, or even we have families that will call. Their oncologists can call and refer them, or we'll have families that will call sometimes if they've heard about us. And then inpatient, of course, they're a rounding team. So the hospitalists will make a referral to the inpatient group to be able to see them.
Yep. Thank you, Allison. Social workers, Emily, help us understand, what do hospice social workers do?
Sure. Thanks, Monica. So initially, our social work team completes a psychosocial evaluation to assess the patients and their families and any needs that they have. We also provide a therapeutic environment to assist patients and families process their feelings and emotions regarding their hospice admission, and also to assist families with feelings of anticipatory grief. We allow families to discuss any anxiety or depression that they may be feeling and help provide some coping skills to help them deal with those anxieties and depression symptoms. We also provide continued emotional support through routine home visits and telephone calls as their family member remains on hospice services. Our social workers assist with linkage to community resources, which can be assisting families with referrals to nursing home or assisted living placement. If the care of their loved one becomes too much in the home, we can make referrals to Lifeline services, as well as meal delivery services, including Meals on Wheels and Movable Feast. We can provide caregiver resources to patients' families if they need assistance providing in-home caregiving through agency resource lists, as well as private paid caregivers. We also have a contact with the VA, and we can assist families with enrolling in VA services and providing communication with the VA regarding any needs the family might have. We also assist in arranging respite care for families, which is the 5-night stay at Coastal Hospice at the Lake or a local nursing home to provide caregiver break. Our social workers assist in providing end-of-life planning. We can help families and patients complete advanced directives. We provide assistance with completing power of attorneys and resources for families who need assistance with completing of wills. We also assist with final arrangement planning. We can provide resources for local funeral homes, as well as assistance with agencies that provide body donation.
Thank you, Emily. It's so many things that our social workers can do, but it's really a safety net around the families and the caregivers. And I remember those letters for FMLA for caregivers. They are so important, so everybody can be around and supportive. And thank you, Emily. But now you also are going to tell us about Coastal Kids. What do we do at Coastal Kids?
Yes, we also have a pediatric program here called Coastal Kids. Our pediatric patients receive all the same services that our adult patients do, which includes nursing visits, pastoral care visits, aid services, and social work services. We assist families with providing additional emotional support to allow the families to process their feelings as their child goes through this hospice experience. We also provide end-of-life planning for pediatric patients, which can include resources for funeral planning. We also do legacy activities with our pediatric patients, which can be different memory books or handprints, or assisting the families with writing letters to their loved one. These are memories that the families can take along with them after their family member passes away.
Yeah. Really, really very supportive of not only the patients that are here, but the siblings or others that might be involved.
Sure.
Now we move to volunteers. Stephanie, tell us, what do volunteers do? You're muted. Stephanie, we cannot hear you. You're muted.
Thank you. Another vital role of our hospice care team plan are our volunteers. And our volunteers are a group of trained and vetted individuals who offer additional assistance to our patients and their families. Our goal is to partner with our patients and their families and offer the best quality end-of-life care and to meet them where they are on their hospice journey. We have many different roles that our volunteers offer. The most common is our patient care volunteers. And that patient care occurs in patients' homes, in nursing homes, assisted livings, Coastal Hospice at the Lake, and the Stancil House. Volunteers come alongside our patients and they offer them companionship. They may want someone to help them sort through photos. They may help them want to write some letters to families towards their end of life. They may want to continue to participate in an activity that they've enjoyed, like knitting. We had a lady in the past who was an avid Scrabble player, and she wanted a volunteer to come and play Scrabble with her. And the volunteer would go with her once a week. She would play Scrabble, and she would often comment to us. She said, "You know, I don't let her win." She really is a very, very good Scrabble player. So in that instance, we were able to offer her some a little bit of normalcy during the week when her volunteer came in to visit. Our caregivers also offer caregiver respite to those who are taking care of their loved ones, mostly in the home setting. If you want to just slip out and go to the grocery store, get a haircut, go to the dentist, your own doctor's appointments. Caregivers still have all those normal things going on throughout the course of the week, and they may just need someone to come in and sit with their loved one so that they continue to do that. We have volunteers who sit with our patients. We've got a caregiver who used to enjoy playing bridge, and so she requested that we have a volunteer come in and sit with her loved one so that she could continue meeting with her group of friends and playing bridge once a week. And she got a lot of relief from being able to do that. We had a husband and wife couple who were both caring for a parent, and one or the other of them was constantly with that parent, and they didn't have time for the two of them to just have their own alone time. And they requested a volunteer to come to the home, sit with the patient so that they could have a date night. They could go out and have a meal together, and very, very successful. The caregivers were very, very happy just to have a couple of hours to themselves. We have volunteers who sit with our patients so that their loved ones can go to an exercise class. So there are many, many different ways that we offer patient care to our families and their support system. One of the other roles that we offer is the Veterans Program. We believe that every veteran deserves to have that last final honor salute and to be recognized and to be thanked for their service to our country. So we have volunteers who they themselves are veterans, and they will go and do a visit with our veteran patients. They present them with a patriotic quilt or blanket, and they present them with a certificate, and they allow the patient to have some time to talk about their time in the military if they choose to do that. And a lot of times the families will share with us that they've heard stories that their loved one never shared about their time in the military before. So it's also very, very beneficial for the families to be able to do that. I had a volunteer several years ago. We also send these veterans to our patients, when they don't come onto our service, maybe as soon as they should have, and they're on towards the end of life. And we had a veteran volunteer who went to Coastal Hospice at the lake, and he did his veterans presentation. And at the end, he offered the final salute. And they told him that this patient probably was not going to respond. And he said, the hand came up off the bed. The gentleman couldn't get his hand all the way up, but the hand did rise off the bed. And he said, I know that gentleman appreciated and heard every word that I have to say. So our veterans program is very, very important to us, and it's very near and dear to our hearts.
Thank you, Stephanie.
Most recently, we've added pet therapy. We're partnering with Pets on Wheels here in Delmarva, and we are offering a visit with a volunteer and their furry friend to our inpatient facility at Coastal Hospice at the Lake and the Stancil House. So any of our patients that are there get a visit, and you would be surprised the response that we get from patients when they have, that precious little dog that comes in and just, kind of nuzzles a hand, and they get to pet them for a few minutes. And it really does brighten their day. And you can see for a few minutes, they have forgotten maybe where they are, and it kind of takes them back to a memory, perhaps a childhood pet, or a time previously in life where their family had a family pet. And you can just see the smile that it brings to their face. We also offer office support. So if maybe visiting patients isn't quite your thing, we have volunteers who come in and assist us in the office with filing and putting materials together for our patients and their families. We offer bereavement support through phone calls and notes. And lastly, we have volunteers who support our thrift shop. Our thrift shop supports the Stancil House, and we have a very, very large base of volunteers that work at our thrift shop that's in Worcester County. So if you're interested in partnering with us and learning some more about becoming a volunteer, you can visit our website and just click on that volunteer tab, or you can call the main number here for Coastal Hospice, and we'd be happy to talk with you.
Thank you, Stephanie. I just want to add that there's a volunteer that gives flowers, and these flowers go to patients. And in the case of my mom, she absolutely loved the flowers. So thank you very, very much. And next, we are going to talk about spiritual care. Sharon, help us understand, what is the spiritual care in a hospice setting?
Thank you, Monica. The spiritual counselor's role is all about supporting our patients and families in an accepting and non-judgmental way. We meet our patients where they are, and we want to provide a safe place for them and for their loved ones to share the big emotions that are often part of dealing with a life-limiting condition. So much of a spiritual counselor's role is about listening. Our patients have amazing stories to share. We often say that we're fortunate because we get to join our patients and those around them on their life journey and hear about what's been important to them, what's been meaningful in their lives. Some of my favorite visits are when couples who have been married for a long time go back in time, revisiting how they met, or sharing about a special trip they took together. People have rich and wonderful stories to share. And when they're telling those stories at the end of life, they aren't just reminiscing. They're doing meaning-making work. It helps them find peace in their journey, and it can often help families to share together in ways that bring powerful connections in these most precious days. Spiritual counselors also listen for signs of fear or anxiety or other possible spiritual distress and make certain that the patient or their loved ones know that we're available to help them explore those feelings and to talk about anything that may be creating that distress for them. Just recently, I spent some time with a patient who initially seemed to only want me to pray with her. Nearly every time I visit her in her home, soon after I enter, she'll say, "Oh, thank you, you've come to pray with me today." But on this particular day, after I prayed with her as she wanted me to, she began to talk to me and to share about some fears she had related to the dying process and questions she had about wondering what that might look like and what happens with her body and her spirit as death comes. We were able to explore some of those questions and just invite her. I just, again, provided space for her to share her feelings, to ask her questions. And when we were finished, she talked about how helpful that conversation had been to her and how much it had relieved some anxiety that she was feeling. Spiritual counselors also assist patients and families with religious rituals and exploring thoughts about God or specific religious beliefs. Sometimes that support's less about the chaplain providing the rituals and more about involving someone, securing someone who can provide what a patient needs in the way of rituals, someone from the belief system that the patient would desire that support to come from, whether it's a priest, an imam, a rabbi, or a parish pastor from the patient's own tradition. We'll reach out and help them secure the support that they're looking for. Just as frequently, though, we support people with non-traditional spiritual beliefs or no religious belief system as they seek hope and encouragement in dealing with their declining health and with their end-of-life needs.
Yep. It's an amazing team that wraps their arms around the families. Someone said to me the other day, hospice makes life livable, not only for the patient, but for everyone around them. Just provided a great example, Sharon. Can you tell us a little bit about music therapy, please?
I can. Music therapy is an established health profession that uses music to address patient and family needs. They do things like helping to manage stress or alleviate pain, to decrease agitation and anxiety. A music therapist can assist patients in expressing feelings and just generally increase their sense of well-being. We are so fortunate, as Monica said earlier, at Coastal Hospice to have trained music therapists who bring so much to our patients and to their families, and even to our staff as well. We all benefit from the provision of care that those music therapists are providing. A music therapist uses a specifically developed care plan and provides carefully designed interventions that support a patient's needs. While a chaplain or another staff member can play a song on YouTube or sing a hymn with the patient, a music therapist has more specialized training that enhances the therapeutic use of music and that sees very specific ways that they can address these patient needs, as I mentioned before. Even when a patient isn't communicating any longer or appears to be unresponsive, music therapists may still help to increase their comfort and quality of life. It can be incredibly calming and provide peace for those caring for the patient as well as the patients themselves. And as I said, the staff around those patients often find that in the midst of our busy spaces, inpatient units, and some of our facilities, we often find that there's just an increase in calm when the music therapists are present on those units. So we appreciate very much what they bring.
Yep, and the audience today will have a chance to experience a little bit of that. We're going to play a video at the end of our presentation. Thank you, Sharon. Now, Alvin, please help us understand, what is bereavement care?
Yeah, absolutely. Thank you, Monica. So, the bereavement department is unique in the fact that our counselors, unlike some of the rest of the department, does not actually have an opportunity to know who the patient is, and we only come in after the death most of the time. So it's so important that we stay connected to these other departments to get a good idea and allow them to communicate us any type of specific bereavement or grief concerns that they may have. We try our hardest to create a safe space for family members just to be able to let go, to be able to, to let the tears flow, to talk about their loved one, and to do that in a manner that is most benefiting for that family. Grief and loss can be tough, no question. Our bereavement counselors do what we can to make it relatively easy to find support when it's needed the most. And we do that by offering group or in-person, telephone, virtual grief counseling for all of our counties. That's Dorchester, Worcester, Somerset, and Wicomico residents. We provide guidance related to grief and loss to families and caregivers for approximately 13 months following the death of an adult coastal hospice patient and 24 months following the death of a coastal hospice pediatric patient. We provide community bereavement activities like support groups, memorial gatherings, and bereavement luncheons. And it's in these settings that you can find amazing peer support. Having someone to share your journey who can understand some of the challenges related to grief and loss can feel very reassuring. And we don't forget the children. We aim to conduct at least 2 bereavement activities for children every year, like Camp Safe Harbor. It's a summer day camp open to children ages 6 to 12 who have experienced a primary loss in their life. That's the death of a parent, a grandparent, a sibling, or some other closely connected person. This camp offers a safe place for these children to express their grief, to explore the many emotions that accompany the death of someone close, and to learn age-appropriate coping skills that will assist them on their grief journey. We do this by having them participate in so many fun activities like a family ice cream party, goofy games, a newsroom experience, play therapy, and finally at the end, the butterfly release. And our counselors want to help our families focus on specific goals to move forward after the loss. And this is simply by validating the past, understanding that no one grieves the same way, and these journeys can look different because there's no right or way to grieve. Also, adjusting to the present. When we lose a family member or someone we love, we're in essence missing a particular role that comes with that relationship, be it the role of a wife, a son, a father. The positions within the family will be updated to develop a new identity based on life without the loved one. And then lastly, by redefining the future, we aim to help bereaved families redefine their future without their loved one as a goal for grief. Our experienced counselors will thoroughly discuss any goals the bereaved may have and work with these ideas to create new opportunities despite the loss. And these may be supported by using insights they learn from conversations that they have sitting in the home, over the phone. And the hope is to be able to find purpose in these new opportunities in their lives. As previously mentioned, the grieving process and the depth of the grief is very different for everyone. And some people may have more severe grief reactions where they need more assistance in identifying and solving the anxiety. So we try to stay connected to community resources as well.
Thank you, Alvin. Thank you so much. The grief journey and talking about how unique it is a whole webinar all by itself. But we have only 5 minutes left today, and I wanted you to also elaborate on the Compass program.
Yeah, sure. So just imagine getting a new understanding that you or your loved one who has been diagnosed with a serious illness, and they're finding it more and more difficult to complete normal daily activities like for personal care. You might notice that bathing or showering has become difficult. Maybe eating, walking has become very challenging. This is where Compass is designed to help. As a Compass admission, access is given to the coordinator to connect them to resources. And what that means is when you need support in dealing with these challenges, a quick call to Compass can direct you to supporting resources very quickly because we've done all the guesswork for the client. There's no need to wonder who to call or what to do next. Compass will work hard with the client or their caregivers to connect them to support resources. In my experience, one of the greatest supports that Compass offers is simply companionship. Our Compass coordinators just listen. We want to know about the children and the grandchildren, but also we want to be able to help you move to the next phase if necessary, keeping you in line and helping you understand, appointments that need to be necessary. And if it comes time to have a conversation that additional or increased care is necessary, we're there to help facilitate that as well. We can't help with everything, but we don't mind trying. And the great thing about Compass is that it's free. It's a free non-medical program that is used to support persons who are having serious illness.
Yep. So for the audience, if you are in doubt whether you qualify for any of these services, just give us a call. You may be eligible for one of them. Any final thoughts? Our audience has been really quiet today. And we are right on time, couple of more minutes. I think we have a video to share with the audience. So I'm just going to turn it to Lauren.
Thank you to all of our panelists from Coastal Hospice for this presentation on a topic that may be relevant for many. And thank you to everyone who has joined us today. We hope the information was useful to you. We encourage everyone to attend our next webinar on Tuesday, January 24th at 12 p.m. Beat the Winter Blues. Please visit our website to register. As Monica already mentioned, we will be leaving you with a beautiful video of our music therapist, Doris Ludicky, playing her harp at the Mackie and Pam Stansel House. After the video, we ask that you take a couple of minutes to fill out a short survey. It's only 5 simple questions. Your feedback will help us bring relevant programs to you, your practice, and those you care for. When you click Leave the Meeting, you will receive a survey from Zoom. We will also send you the link to the survey in our follow-up email to you. This was a presentation from the Coastal Caregiver Academy, supporting and empowering caregivers in our community. At Coastal Hospice, we are here for you, and you can call us at any time on the number on your screen. Thank you once again for joining us, and please enjoy Doris's beautiful video. I am Lauren King, and have a wonderful rest of your day.